I'm going to explain to you how Teeth on 4 works. It's also known as Teeth in a Day. And essentially this is a very attractive treatment that patients come to see us for having problem teeth or teeth that have been affected by gum disease or just generally missing teeth. And patients want to have something that's fixed and that's comfortable in their mouth. Okay? So unlike other treatments, this is actually something that feels as similar to natural teeth as is possible. It's probably the most advanced treatment process that we have today for patients wanting to have something fixed in their mouth. So generally this is similar to how patients come and see us with broken teeth or missing teeth, and we're able to remove these teeth and place implants on the same day. We're able to do that because implants have changed in terms of their design, and the design of implants means that it can actually anchor itself very firmly in the bone. So it creates a very firm foundation for teeth to be actually supported on those implants on the same day. Once the patient's been assessed that they're suitable for this treatment, the procedure is carried out usually in the morning. The surgery takes about 2.5 hours and it's carried out under sedation, so patients are very much comfortable throughout the procedure. And we will remove teeth and place implants at the same time. Once the implants are in place, we will take some impressions and some teeth will be made that we can actually deliver on the same day, usually at the end of the day. After surgery, patients are either waiting at home or we help with accommodation that's close by to the practice, so the patients can relax and wait for the teeth to be made. The teeth that are delivered on the same day, it's called a provisional bridge, and this provisional bridge is basically suffice to basically be able to eat and function normally on it. It is a bridge that's made within a few hours after the surgery, so it's essentially something that's going to be in the mouth for about 6 months while the implants are healing. In the treatment that we provide at the Brighton Implant Clinic, all patients will have 2 bridges. So the first bridge will be the provisional bridge, and then we have a definitive bridge after 6 months. During those 6 months, the patient will need to come back and see us, and we will be checking that the implants are healing well, that the gums are healthy, that the patient is cleaning properly underneath the bridge, and if everything's okay, we will then start to make the definitive bridge after 6 months. Essentially, the bridges are very similar. The main difference is that the definitive bridge is much stronger because it has a reinforced bar on the inside, which is made of metal. Patients are able to play a role in actually choosing the shape and size and color of their teeth. We've got like different molds in terms of size and color. Patients will obviously have a preference maybe for the color and shape of teeth, and then with some advice from both the dentist and the dental technician, we're able to give most suitable shape and form of teeth to the patients. We have both fully anatomic teeth as well as some teeth that are just veneers, which are also attractive in terms of appearance. It's all really patient focused as to what will be the most suitable and what the patient prefers most for the final bridge. So this is an example of what's called a wax try-in. Essentially, this is checked with the patient first before it's actually completed. Once it's actually in the patient's mouth, we're able to give the patient a mirror. They're able to check that they're happy with the position of teeth, what the teeth look like. Together with our technicians that we have in our laboratory, we're able to move teeth forward, backwards. We're able to change the color of teeth exactly how the patient wants them to be. So it's a lot more specific and a lot more tailored to a patient. It's quite unique to us because we have a laboratory in-house. It basically gives us an opportunity to have a much greater communication with our technician, and they play a lot more of an active role in actually delivering the final prosthesis for the patient. So once the patient has actually agreed and they're happy with the position of teeth, we will make what's called a metal try-in. Okay, this is the difference between the provisional bridge, and this is essentially a bar that's actually buried within the teeth that gives strength. So it basically provides strength and rigidity so that the teeth don't move during function. It's very important, obviously, that that bridge is as rigid and as strong as possible, because to avoid fractures and avoid teeth breaking. So this is a significant or different part between the provisional bridge and the final bridge. The finished product essentially looks like this. This is what we call a hybrid bridge. It's a combination of not only teeth but also gum tissue that's been lost. Here it looks quite different, but in the patient's mouth it looks very natural. It's very comfortable. The bridge is secured by means of some small screws, which are actually placed hidden away from view, and the bridge can be removed or replaced very easily by accessing these screws. So all the bridges that we make at the Brighton Implant Clinic are screw retained. That will make it easy from a retrievability point of view. Another example over here, this is quite common. We're working with patients that are having upper and lower teeth on fall. Usually this gives us the most flexibility in terms of improving aesthetics, because we're able to modify the smile line, the position of teeth, the color and the shape. We've basically got pretty much all options available to us, as opposed to when we're dealing with just half an arch. Obviously that needs to conform to the opposing arch as much as possible. Obviously we're only treating 2 arches when it's clinically justified, when patients have no teeth in either the upper or lower jaw. So as part of the treatment, we give what's called a water pick, and it's like a water jet that essentially is used to clean underneath the bridge. So for example, if we look at this example over here, the bridge is actually designed to actually jet water or mouthwash underneath the bridge, because there's essentially a space in between. And because this is fixed and it's not removable, we obviously tell patients it's very important to actually make sure that it's kept nice and clean. This is the model that we actually give to patients as part of the treatment. It's actually a cordless model, so it can be taken away with you if you're going away on holiday. We recommend that it's used every day. In addition to the water pick, we recommend these brushes, and they're made by a company called TP, and essentially they're used to clean in front, in between the bridge and the implants. That's the most important part, is where the implants actually connect to the bridge. So we use this basically to clean at the front, in between, and this one is exactly the same thing, but used on the inside to keep that area clean.